all of the researchers I've read on the papers in the last number of years, they all say at the end of their study, we have to practice more prevention. We have to let people of reproductive years know how important it is. And they need, excuse me, they need to stop drinking, they need to stop smoking, they need to stop drug use, and they need to lose as much excess weight as they can in at least the 6 months before conception, because your health of both the mom and the dad in those 6 months are going to influence what you pass on to the child at the time of conception. Excuse me. My allergies are not good here, so I need some water. Yeah, it's a little worse in Virginia. But then I don't talk this much in Virginia. Oh, was that my husband had an editorial comment? Okay. One of the reasons why this is so important is that more than 50% of pregnancies in the United States are unintended. And so mom and dad can be not necessarily taking care of themselves before. And more than 50% of women at the time they get pregnant are overweight or obese. So we already have a potential for the next generation to not be so healthy. And it certainly isn't done on purpose, but I think we have to do a lot more education to have people understand that and to take steps to make change early enough. And part of the difficulty we have is that our infant and maternal mortality rates are terrible. In this country, moms and babies are dying at a much higher rate than they do in many, many other countries. And yet, we hear how we have the best healthcare system in the world. We do have the most costly healthcare system in the world. It does not necessarily trickle down to everyone. A lot of reasons for it. One are rural areas sometimes just don't have the practitioners necessary to give adequate prenatal care and adequate postnatal care, which is after delivery. Moms may have kids at home, may live 2 hours away in rural areas from healthcare. A lot of women don't get prenatal care and can show up in the emergency room in labor. And you have no idea what the risk factors she may face, including preeclampsia, which I'll talk about in a little while. You don't know what risks are to her and her baby as she goes through labor. There are also hypertension, poor postnatal care. Even with insurance in the United States, you will get one postnatal visit at 6 weeks. Yet for 3 months after having a baby, there's an increased risk of stroke for the mother. And that's just not something most people are aware of. There are complication risks, of course, with not much care, and preeclampsia is one of them. Gestational diabetes is another. Problems at the time of delivery, problems with the baby at the time of delivery. Gosh, these are really small. Okay, we'll just go to the next one. You probably can read it better than I. This is a very interesting report. It was done by Blue Cross Blue Shield. And they looked at millennials starting about the age of 27 and looked at the information they have accumulated on the people who have their insurance. And they found out by the age of 27, people are already beginning to get unhealthy. They're already beginning to show signs of risk factors of early metabolic conditions like diabetes, cardiovascular disease, and even cancer. So then they narrowed it down and they looked at millennials between the ages of 34 and 36, and they already had higher rates of the top 10 common conditions. And yet this group thought they were in good or excellent health. And the other problem here with this age group, they're making babies. And so we have to look at what are they passing on already to the next generation. One of the things that I've thought about a lot is why are we in this last 10 or 20 years see so many young kids that are overweight and obese? Why have we had escalating rates of Alzheimer's? Why have we had escalating rates of ADD and ADHD? What happened that affect these conditions. And I look back, of course, in 1980, when all fat had been demonized by the United States government, and we saw young women coming to the Atkins Center who were afraid to have any kind of fat in their diet. And then they get pregnant, and their body is deficient in an essential building block of the body and the brain. And what's the effect of that if they get pregnant and that child doesn't have the necessary nutrients, both in their fetal environment, but also if their mother is really fat phobic, especially if there's a little girl and they're afraid their daughter's going to get heavy. I'm talking too much, okay. What's going to happen when that child is starting to be fed by their mother and the mother isn't giving them an essential building block of their body and their neurology, which is fat? And so I think we see that now. That's just my observation. Now this group had higher rates of a number of conditions. Of course, substance abuse we know, but depression, hyperactivity, type 2 diabetes, Crohn's, ulcerative colitis, risk of colon cancer, hyperlipidemia, hypertension, smoking, and obesity. This was not a population that is as healthy as they think they are. And the rates, of course, are higher in the southeastern part of the United States, where unfortunately a lot of people don't have health care, especially if they're a lower social economic level. And it does have a direct impact on all of us. Increased health care costs that have to be picked up by the taxpayer. Companies have decreased productivity in an unhealthy population. And so these things do affect all of us. And so these young people are becoming parents. Overweight and obesity is a risk in pregnancy. Increased risk of birth defects. Some of them are spinal bifida, which is a spinal defect. Others are similar neural tube defects, which is a neurology problem. Heart problems, heart valve, malformations, cleft palate, cleft lip, and hydrocephaly, which is a condition where the child's brain doesn't properly circulate cerebral spinal fluid and their head swells, which can, without treatment, can actually lead to some very serious consequences. Miscarriage and stillbirth. In the United States, we have a very high rate of miscarriage and stillbirth. According to the March of Dimes, preterm birth in the United States rates 130th out of 184 countries. That means 129 countries do better with stillbirth than we do. And a preterm birth can increase the cost to the family, can increase the cost to our whole economy, because these children really can need, in order to survive, if they survive, a lot of care until they get better, if they do, or their families are going to be financially stressed with a child who's going to have disability for much of their lives. In the second trimester, when the fetal brain continues to develop, areas of the brain that are affected by appetite regulation and by autism can be affected, and we certainly see increasing rates of autism. There are lifelong health risks to that child for asthma, for type 2 diabetes, for heart disease, and for obesity. And gestational diabetes, of course, is a complication of overweight in pregnancy. So, as I mentioned, U.S. women continue to die at much higher rates. Gestational diabetes, a complication of pregnancy, usually tested for around the 24th week, but if you're a woman who can't afford it, who can't get access to it, she may not know she has gestational diabetes, and that baby in the uterus and after they're born are at high risk of problems. There's a higher risk of C-section, there's a higher risk of preeclampsia, which can lead to seizures and death of both the mother and the baby if it isn't identified. And that's why when you go for regular prenatal visits, they check your blood pressure, they check your weight, they look for swelling, and they check to see if you have protein in your urine, and those are signs of preeclampsia that have to be monitored and addressed if necessary. I mentioned birth defects also with gestational diabetes. Babies are born too large. Insulin is a fat storage hormone. A baby in her mom's uterus If she's exposed, or he, to high amounts of insulin, she will get bigger. And pushing a 10 or 11 pound baby out may be a real problem. Baby can get stuck. There can be damage to the baby's shoulder. They can have a lack of oxygen during labor and delivery. They can die. Or an emergency C-section may have to be done. So these are a lot of reasons why our infant mortality rate in the United States isn't very good. And a lot of it is related to what we eat and our lifestyle, which is fixable. C-section rates in the United States are the highest. About a third of our deliveries are C-sections. The next country next to us is 15%. So just imagine the economic costs of a cesarean section. And the cost to the parents, especially if they don't have insurance and that baby has to be monitored in the first hours after delivery. There are complications to the mom if she has gestational diabetes. Within 5 to 10 years after that delivery, she's at risk for type 2 diabetes. So imagine if she's a 25-year-old woman in her first pregnancy and she has gestational diabetes. By the time she's 30 or 35, she may have type 2. The infant is an issue. It has to be monitored after gestational diabetes pregnancy. They have to be monitored because they can get a severe hypoglycemia, which needs to be treated. If it isn't, if there isn't, then we got a problem. I'm going to skip some of this because I know you're not eating for two. That is a myth. You only need about 300 calories a day and only the last 3 months of a pregnancy. So you're not eating for two. I'm going to skip all the metabolic syndrome and prediabetes because Amy did such a great job. I will say about A1C, that is not a test that should be used to diagnose gestational diabetes. It shouldn't be used in kids and should not be used if someone has sickle cell anemia because you're not going to get an adequate number. Cardiovascular disease in women is really getting to be a bigger challenge. It's often thought of as a men's disease, and I'm afraid there's still a lot of people who think of it that way. The symptoms can be different in women than in men, and that's one of the problems why it's not recognized by both the patient having a heart attack and some of the doctors. Same number of women, men and women both die of the same thing, cardiovascular disease. And according to the Center for Disease Control, some of the recent statistics show that in Caucasian women, there's an increased mortality rate by 12%. So we aren't doing very well there. Only 54% of women know that heart disease is a major cause of death of women. How many women here is that new information for you? Oh no, then we've educated you well enough so far, that's good. And 64% of women with no signs of heart disease or symptoms will die their first heart attack. Women's symptoms can be different. It can be a different kind of pain. You can also have pain in the neck, pain in the throat, pain in the abdomen, pain in the back. And a lot of times women will have those symptoms and delay getting help, which means they may not survive getting to the emergency room. There is a bit of a gender bias, not conscious gender bias, but they looked at emergency rooms where male and female doctors worked together and found that when female doctors took care of male or female patients with a heart attack, their survival rates were about the same. They were different when male doctors took care of men and women. The women had a higher mortality rate. Not consciously, they're not out there trying to kill women. But they either don't have an understanding that women can present differently, or don't take women's symptoms seriously. And I know over the years I've had a lot of patients tell me how women are given a prescription for a tranquilizer rather than really looking at what else could they have. So risk factors for women and men are pretty much the same. The women will have additional risk factors for gestational diabetes or PCOS. Cancer, this is an important one because more than 50% of people in the United States don't understand that there is an association with obesity and diabetes with certain cancers. And I'll show you in a slide in a moment. Those cancers that can occur at higher rates. And so all the more reason really to start taking care of your weight as early as you can. The American Cancer Society has stated that excess body weight is linked with 8% of cancers and 5% of deaths. 55% of cancers in women, they have a few body parts that are more likely to get cancer than men do, and 24% in men. The more obese you are, the higher your risk. If you're slightly overweight, there's a much lower risk. But as you gain more weight, your risk for cancers go up. And the reasons are, I think, kind of obvious. Visceral fat and inflammation, which Amy talked about, is one major one. Cancer is an inflammatory condition. And other hormones, and that would include estrogen, that would include insulin and insulin-like growth factor, of course. High blood sugar in people with diabetes have higher rates of metastatic disease, of cancer spreading, than people who don't have it. That's because of the hyperinsulinemia, most likely. They did a study in mouse colon tumor cells, and they found out, regardless of the weight of the mouse, high fructose corn syrup could stimulate cancer cells. All the more reason to get off of anything with high fructose corn syrup. This is the slide with the different target parts of the body where we see higher incidence of cancers. One of them that's particularly upsetting is the pancreatic cancer and colon cancer. Abdominal fat is a driver of the inflammatory chemicals and postmenopausal cancer cell growth. Visceral fat, as I mentioned, it can be increased, and inflammation. Body fat before the age of 50 can increase your risk of pancreatic cancer. And we're seeing higher rates of pancreatic cancer since the year 2000. And those of you who know anything about pancreatic cancer, this is not something you ever want to get. It's the fourth leading cause of cancer death in the United States. There's no good treatment, and people are very ill. Now, this leaves implications for young, obese, especially type 2 diabetic kids. If they start out so early with this condition, what's going to happen as they go through their 30s or 40s or 50s? And what we are seeing is an increase in colon cancer in younger people now. There's more and more we've seen in the consumer print that people in their 20s and 30s and 40s now are developing colon cancer. And a lot of times it isn't diagnosed because no one looks for it in people that age until they're in a much later stage of the disease. And so again, as far as prevention, we have to take seriously some of the symptoms that we have before we really get sick. And that would include, as Amy talked about, belly fat. And that's so important. So what I have my patients do is, I hate when they pay a lot of attention to the scale. Scale isn't a good marker for fat loss. And I don't like to use the word weight loss either. It's about fat loss. So I have people take their measurements, particularly the measurements around their middle, because you want to see those fat cells getting smaller. And that's really what you want to pay more attention to. So prevention, as I've mentioned, is a must. You have to begin to address the child's diet not only while they're in the uterus or when they're breastfeeding, but within the first year or two is where children develop their taste for foods. Please don't give them sugar. That is the worst thing you can do. You are creating, in all probability, a sugar addict who's going to tend to struggle more. Breastfeeding, if you can. It has to be a whole family affair, so it's a child who's having trouble with weight and a child who has difficulty controlling carbs. The whole family has to get their act together. And a lot of times, the overweight mom and dad don't want to change what they eat, but they want their child to. Your kid isn't going to listen to what you say. They're going to look at what you do. Well, okay, I guess that's it. Thank you.